I know that you have taken all the measures seriously, you and your wife, and the COVID seriously, and you were vaccinated on time. And yet, despite all of this, you got COVID. Could you tell us a little bit about how did it happen? What happened?
Well, I had knee surgery, and it went very well, and I was surprised that the knee surgery did so well, and I was recovering from that at home, and began to get fever, and it kept going up and up. In 4 or 5 days, it got to 101, 102, and I thought I better go to the hospital. And I didn't know that I had COVID, but I thought we better check, and then I was not waiting any time. I was quickly taken into the emergency rooms and evaluated, and I had a CAT scan and another test which indicated that I had COVID-19, COVID pneumonia. And they began to treat me, and I had to deal with the limitations and inconveniences of the situation. I had things all gathered around me, and I had excellent nursing care and doctor care, and they were there ready and helped me with anything, and very kind. And so I just went, how many days was I there? I was there 11 days.
And during those days, you did have a problem with the fever and also some problem with the oxygen.
Yes, fever and my oxygen level, and they were regularly checking it, and it was not high enough for me to go home. And the challenge was to get my oxygen up, and they did more exercises to make that happen, had me exercise more. But for the most part, I just stayed in the bed for 11 days and was really weak afterwards.
How did you explain to yourself that you, having been vaccinated, nevertheless you got infected with the COVID?
Yes, well, I don't know where I got the information, but I had read before this occurred that the vaccine would not necessarily keep you from getting the virus, but that if you got it, it would not be as serious and would not be as severe. So that's what I thought. I was blessed to have had the vaccine. It did not go down into the ventilator stage, and I was not, obviously sick, but I wasn't as sick as I could have been. And I was blessed to have my oxygen levels go up, and the various other requirements for improvement come to the point where I was able to go home after the 11 days.
There are many, unfortunately, who are saying that vaccines do not help, that we can survive COVID just on our own without any help for the vaccines. When you think about yourself and your case, is your feeling that actually being vaccinated helped you to make through this your experience with COVID?
I definitely do. And I was confirmed in that when the home health nurse came out to our home afterwards, and she was examining my situation, and she said, "Mr. Stallknecht, you are a lucky man." Because she'd dealt with so many people that were not so lucky and really got down into serious stages of this thing. And I just thought to myself, yes, I am lucky and blessed by the Lord, but at the same time, I knew I had taken the vaccine, and I strongly suspect that had a lot to do with it.
There are many who are hesitant and afraid because they are listening to all kinds of rumors news,
Well,
misinformation. What would your message be to them?
Well, I can understand why they would be reluctant given all the, what I say, misinformation that is going on out there. But I would say, first of all, think about the past. I don't know the past of everybody's experience, but when I was in school, we were trying to take vaccines for all kinds of diseases, typhoid, smallpox, diphtheria, and and sometimes the side effects were really hard, and I'd have to stay home from school for a long time, or 4 or 5 days, but nobody objected to taking the vaccine, even with the side effects. Everybody just understood we didn't want these terrible diseases, and that was the mindset. When the polio vaccine came out, oh, we were so glad to get this vaccine that we wouldn't get this terrible disease, and it was so crippling and so hard for so many people. And so, yes, in the past we've had vaccines, and nobody had trouble with it, and there was no ideology about it, and nobody was talking about their freedom, and we just took it because it was a good thing. So think about the past, and then think about what constitutes authority for you. If you Facebook is the authority, well, that's not a good source, or some news channels that specialize in innuendo and smears and that sort of thing. I would say think about authorities you might respect. In my case, I thought about famous universities that have been a reputation in medicine for a long time. Johns Hopkins University, the Mayo Clinic, they all were saying this. In our hometown, the Houston area, we have Methodist Hospital, who I respect. They were saying get it. Authorities that I respected said to get it, and so I just invite people to check out authorities that constitute authority, that or really have some expertise. Nobody's perfect in anything, and no authorities are right. But and then one thing about science, you have to understand it's always self-correcting, and they're always open to new information and for changing the diagnosis and the strategy and so forth in the light of new information. But so they're just working on the basis of testing and information they have, and they've come up with the vaccine, and I just hope people will take it.
Today we frequently hear so-called arguments that I'm free, especially from Christians. I'm free in Jesus, and why should I bother about being vaccinated? That's my freedom, that's my right. And yet the question comes, how does the teaching, theology of freedom in Christ really come into the picture when we are talking about our social responsibility towards each other?
I would start briefly now with God's love of us in Jesus Christ, which we accept in a trusting faith, and if we accept that as a free gift unconditionally, then there's a inner motivation to love the one who loved us and to be concerned about the same values that the one who loved us has. And whoever we make is our ultimate support, our ultimate concern. We're going to be inclined to appropriate those values. So we're freely moved to have the values of Jesus Christ, which is the love of God and the love of neighbor. And yes, we go vertical to God, but if you're a Christian, then you also go externally to the neighbor. And as we applied that to COVID, we said, how can I serve my neighbor in the midst of this disease? And one of the minimal things we can do would be to get the vaccine so we can keep other people from getting it. And then it's just a totally misunderstanding of freedom, the way the secular world uses it. and that it just, when they use it, it just means selfishness. And when the Christian faith uses it, it means self-giving and service.